Issued by the Tennessee Department of Mental Health and Substance Abuse Services aim to improve children's mental health. Now, this money will expand the Crisis Stabilization Unit program, where kids experiencing a mental health crisis can go to receive short-term services. State Capitol reporter Tori Gessner explains the impact.
It's the definition of investing in the future to help solve an issue you can't always see: children's mental health.
The state of mental health with kids is mixed.
Marie Williams, the commissioner of the Tennessee Department of Mental Health and Substance Abuse Services, says during COVID, rates of anxiety and depression in kids were at an all-time high. But things are improving in Tennessee thanks to resources like crisis stabilization units, staffed with mental health experts, where kids experiencing crises can go for help, free of charge.
Rather than going to an emergency department that may not have the same training as a mental health crisis center, this is an alternative.
The CSU has two parts: the Crisis Walk-in Center, where children are assessed by mental health experts who come up with a care plan, and the actual Crisis Stabilization Unit, where some children can stay for up to 5 days to receive round-the-clock care by psychiatric specialists.
That CSU is connected to a community mental health center who then can see that child afterwards.
The first CSU launched in Knoxville in 2021. Nearly 2,200 children and youth have received services since, and 94% of them were diverted from hospitalization.
That means that that kid got what that child needed, the family got what they needed, and they were able to then connect and have follow-up resources.
It's a big impact Williams hopes will create a ripple effect in Nashville and Memphis, where the CSUs are expanding thanks to a state grant, an improvement in children's mental health that will have a lasting effect on the future.
It helps them see that recovery is possible. You're not your diagnosis. It just simply is something like if you develop asthma, it's simply a health concern that can be addressed and that child can recover.
Reporting in Nashville, I'm Tori Gessner.
And Tennessee's Department of Mental Health and Substance Abuse Services hopes to have those two new crisis stabilization units complete in a year. Now, in the meantime, if you or someone else is experiencing a mental health crisis, you're encouraged to call 988 to receive help.